Everyone. So the present session on electives, this workshop has been designed because it is a new element in our competency-based curriculum. And it is a mandatory requirement as per the new curriculum for the students who are admitted in batch 2019. So now the students of batch 2019, they are giving their exams of second professional MBBS and they are entering third professional part 1. So at the end of third part 1, they have to do electives, which is mandatory for all the students. And the various details about the electives, that when it will be conducted, what are the prerequisites for the electives, they all will be discussed in detail by Dr. Medha. And then we will need to do plan our at least one elective in this during this workshop only. We've already shared a pre-test, so we expect all of you to fill up that pre-test and submit it. It will give you a sensitization that what we are going to discuss in the upcoming half an hour or 1 hour. But it will also give us that it will give us a count that how many faculty members are there with us. So it will be kind of attendance, and you will be given a virtual certificate for the same. Only to those who are filling up the pre-test and post-test. And you are required to make one elective during the workshop, and rest of the work you can do later. And you have to submit the electives from your department to the Dean office by 28th of February. So you will have almost more than a month to prepare and submit the electives. And they have to be submitted by all the broad specialties and super specialties. So from pre-clinics, para-clinics, clinical departments and super specialty departments, all the departments have to prepare their electives and submit to the Dean office. So now, Dr. Medha, you can start your presentation.
Very good afternoon,
we will pick up your questions as and when required or at the end of the session.
Yes. Thank you very much, ma'am. From this point, I would like to tell that I request everyone to keep themselves on mute. Please keep your cameras on and keep yourself on mute so there will be no disturbance during the presentation. You can ask anything if you have anything to ask by unmuting yourself, or you can post your questions in the chat box. And you can also raise your hand if you have any query. We shall get back to you after the presentation or maybe in between the presentation. I have received only 24 responses in the pre-test, so I request all the participants who have joined late to please fill the pre-test. Meanwhile, I'll start my presentation on electives. Is my presentation visible? Is my screen visible?
Yes, it's visible.
Okay, thank you. So I'm Dr. Medha Mathur, faculty in Medical Education Unit of our college. So we will be discussing about electives, and as I assume that all of you have already gone through the resource material that we have shared with you. So I assume that you have a fair idea about the electives, so it's not going to be entirely new thing for all of you. So just before we start our presentation, can anybody tell me what exactly do you think about electives? What are electives according to you? We'll just take a minute or so to get an idea what exactly everyone is having idea about electives. Anyone who would like to volunteer, please unmute yourself and answer.
Hello. Hello.
Yes, please.
What I read in the what you have provided the material is the learning experience of something you want to something that the students can impart their knowledge and learning experience about a specific area of interest that they are interested in. What I thought.
Yes. Very well said, ma'am. Anyone else who would like to share any experience or anything that that comes to their mind when they think about electives, or the term electives brings to your brain? Anyone?
To know the area of desired interest.
Okay, area of desired interest. Okay, thank you. These are like almost we have reached.
Elective is something we elect what we want. So elective means whatever subject he has the interest, he has to develop in that. So it will be electing, they will elect themselves. This is my choice, choice.
Exactly, sir. The choice, whatever they want to elect, they can do in the duration which is being provided for the elective. Any other responses? Anyone else? Okay. So from this point, I'll take up. So basically, during this particular discussion, we are going to have a look on the rationale and advantages of electives, the timeline and how the students will be distributed, what planning and coordination will be required, and we will be developing some electives also. So this particular image says it all. As we already discussed that, yes, it happens that after MBBS or even during MBBS, we feel this dilemma, what I'm going to do later on. So this particular topic of elective is going to give a fair idea to the student that so that they can pursue the topics of their interest. Whatever they are interested in, they can take a peek at that particular topic or that particular subject by choosing an elective in that. So after completion of MBBS, while choosing a PG branch for themselves, they will not be standing on a crossroads thinking, what should I do? Where should I go? What is my area of interest? It happened with most of us that we were not having any idea that what exactly I'm good at. What subject will suit me. So in this duration of elective, we are going to tell our students to choose something which might interest them, which might be like intriguing for them, so that they will go ahead and take a look at that particular department or that particular subject with more intensity, more by experiencing it. So this is all about elective that we are going to discuss. So it's a learning experience created in the curriculum to provide an opportunity for the learners to explore, discover, experience areas of interest in the profession. Very brightly said by all the participants who answered this particular thing. So this is just like experiencing whatever they want to experience. They can choose whatever they want to choose. They can discover whatever they want to discover by choosing the appropriate elective for the duration which is being provided to you. So it is basically it's a brief course which is being made available to the learners during their undergraduate study period. And this is actually a new, not a new concept. Western culture, Western medical education was doing it for so long, but now for us, NMC has introduced it for the new batch which is going to come to us in the next year. So it is it will be implemented for 2019 batch, and the implementation will be done in 2023. And the students can choose from the available options depending on their interest or maybe their career preferences. So a basic aim of elective is to provide the learner with the opportunities for diverse learning experiences. Actually, we have a curriculum and we as medical teachers follow that particular curriculum. But to provide them such an experience which is not there in the curriculum, which they can have according to their choices, makes the sense. And sometimes this elective is also going to provide them the research opportunities. It is also a self-directed learning opportunity. Experiential learning will be there, and a lateral thinking will also be stimulated by doing the electives. So this is the main objective, or say the aim of electives, so that if the student will be able to achieve this kind of research acumen or have a learning experience, the aim of the elective will be achieved. So the foremost thing which comes to our mind that they are with us for say 5.5 years of duration, and all the slots are already being taken. Where are we going to place this particular elective thing? So the electives will be done after the completion of phase 3 part 1. Traditionally we call it as final year, like where community medicine, ophthalmology and ENT are being like taken. After the completion of phase 3 part 1, they will be given an elective for 8 weeks of duration, which will be divided in block 1 and block 2. And after completion of this elective duration, they will be going to phase 3 part 2. That is the final year. So this is the particular place where these electives will be taken. So moving ahead, there are 2 blocks as already told. Half of the students will go to block 1 first, followed by block 2. I will be explaining what block 1 and block 2 are. And it is an compulsory activity for all the students. And time for this elective, this is very important for the faculty members, that this time is not going to be used for missed clinical posting, shortage of attendance, or any other purpose. We have to engage the students in the electives only. This particular duration of 8 weeks cannot be used at for any other activities. Okay, for short attendance, you cannot call the students, okay, come to the department or come for the lecture so that your attendance will be compensated. No, you have to take the students in the electives only. So block 1 will be done in the pre-selected preclinical and paraclinical areas and other basic science laboratories, or under an ongoing research project of the department. So block 1 will be having preclinical, paraclinical and basic sciences. While block 2 will be done in the clinical departments, which will include all the specialties, super specialties, ICU, blood bank, casualty, and also in the rural and urban community clinics. So this is the distribution of block 1 and block 2. So institution will predetermine the number and nature of the electives, name of the supervisor, name of the number of the learner in each elective based on the local condition or whatever resources we are having. So here we have this liberty to decide the number of students in each elective, type of electives that we want to make. This is at our discretion. Whatever we want to make, we can make for our students. And this particular number will be predetermined. We cannot change once we publish this particular information for our students. We have to keep that only. During block 1, the clinical postings will continue, while during block 2, there will be no clinical postings. We will be discussing more about block 1 and block 2. When the student will go, half of the students will go in block 1. During that period of time, clinical postings will be continued. And half of the students will go in block 2. For those students, no clinical postings will be there. For the next 4 weeks, the situation will be reversed. Those students who will be going to block 1, clinical postings will continue, and block 2, clinical postings will not continue. So clinical postings will continue for all the departments at all the point of time. Just half the students will be taking the postings, and half the students will not be taking the postings. So now I'll be launching a poll. Just answer this particular poll. You must be having a poll on your screen. Just answer it so that we can have a look at the polls. Okay, so we have got 35 responses, and out of them, 26% are saying that their specialty belongs to block 1, and 74% are saying that their specialty belongs to block 2. So by this poll, I guess everybody now understand that what is the meaning of block 1 and block 2. At least you are able to identify that your particular specialty is now in block 1 or block 2 makes all the sense. That means you know how to distinguish between block 1 and block 2. So today this shows me that we are having more specialist or more clinical people with us than the paraclinical and preclinical people. Thank you. Are the results visible?
Yes, the results are visible.
Okay, so these are the results. 38 participants answered. Okay. Okay, now moving forward. These are the examples of block 1, block 2. These are the basically examples which are shared in the module, that what all things will come in block 1. So all the laboratory experiences associated with pathology, microbiology, virology, biochemistry, genetics, molecular biology, immunology, pharmacovigilance, clinical pharmacology, infection control, and other community outreach experiences like assisted living, hospice care, school health program, maternal child health outreach programs, community outreach program for national health programs. All these things will come into block 1, along with some ongoing research projects which may be student initiated or participation of faculty research projects, community or epidemiological surveys, and others like bioinformatics, tissue engineering, telecommunication, computer and artificial intelligence in healthcare. All these things will be included in block 1. Similarly, in block 2, we have clinical specialties like emergency, intensive care units, psychiatry, adolescent reproductive health issues, neonatology, dermatology, healthcare quality and safety, rehabilitation, palliative care, sports medicine, clinical ethics, super specialties like hematology, oncology, rheumatology, endocardiology, endocrinology, diabetes, nephrology, neurosurgery, cardiology, GI surgery, organ transplant, anesthesia, urban and rural community experiences, rural community health centers, primary health care, corporation health clinics, selected private primary care clinics. All these things will come into block 2. These are just examples. We can make our own electives in our own decided branches or in our own decided specialties according to the availability of resources and faculty members. So let's have a look at the timeline, how this whole process of elective launching will happen. So this is the basically timeline. So first thing that we are doing right now in 2022 in January is the orientation session for faculty members and identification of the internal and external preceptors. We will be talking about preceptors later. So here we are in the orientation session right now, and in the for the month of January and February we have to prepare the modules and learning resource material that we have to provide to our students. So by 28th of February, all the departments, as ma'am already said, will be submitting their electives in the dean office. In March, we will be updating the students about the available electives, and we will take one orientation session for the students then. From March to August, training of preceptors and refinement of electives can be done. And in the month of September 22, we will invite the application from the students for the electives. In October 22, allocation of electives will be done for the students. In February 2023, we will be launching the electives. Okay, for block 1 and block 2, and in the March, block 2 and block 1 electives will again go on. In the last week of 2023 March, the documentation, logbook completion and presentations of the electives will be done. After that, the feedback sessions will go on, and all the stakeholders will again meet for refinement of the electives in a better way. So this is the timeline that all of us have to follow, and right now we are doing it in the January and February. By February, we have to prepare all the modules of the elective for our institution. Now coming to the student distribution, as I already told you, the block 1 and block 2 scheme. In block 1, 125 students will be there. In block 2, 125 students will be there. In the first 4 weeks, the students will be distributed like that. And after that, a crossover will happen. And for the next 4 weeks, the students who have already done block 1 will go into block 2, and those who have already experienced block 2 will go into block 1. So this is how the student distribution will happen, and this is how the students will be going in the electives. Block 1 will be having all these areas, block 2 will be having all these areas. So this is about the student distribution. Now, the role of the institute, as I already discussed, that all the institute will develop their own mechanism for allocation of electives, and it is preferable that we provide a list of electives of available electives to the student in the beginning of the academic year. So they will be having their academic year say by February, and we will be providing them a list of all the available electives by March. This is what we are planning. And learners have to submit a learning logbook based on both blocks of electives at the end of the completion of their electives. So let's have another poll. Please mark this. Okay. How much do you think minimum attendance is required as per elective module? How much attendance by a student in the elective is required? Please answer. Okay, right now I can see 31 participants have answered. Okay, so here I can see 34 participants have answered, and out of them, 6% think that it is not mandatory, 3% think that 85% attendance is required, and 85% people think that 75% attendance is required. So I'm ending the poll and sharing the results. Are the results visible?
Yes, the results are visible.
Okay, so it's not going to be like not mandatory. The attendance is going to be mandatory for all the students, and the right amount of attendance which is required is 75%. So minimum attendance that a student should have during 4 weeks of electives is 75% of attendance. If they are not having that much of attendance, they will not be allowed to sit in the exam of final year. So this is a mandatory activity for all the students that they have to do. Okay, so I guess now everyone is clear that 75% attendance has to be like maintained by the student during the electives. And submission of logbook maintained during the elective posting is required for eligibility to appear in the final exam, as I already told. So this is an important and very vital activity for students. This is not just a fun activity or time wasting activity. They will have to do it very sincerely. Only then they will be eligible to sit in the final MBBS exams. There are certain advantages, as we have already discussed most of the advantages, that it is going to give explore areas. They will be having an opportunity to explore areas. This will be a self-directed learning skill, and they will have a direct experience of working in the interest areas. It will help them in deep learning, critical thinking. And the most important thing is that this is a student-centric component in the curriculum. This is not a teacher-centric component. Student will come ahead with some elective of his or her choice, and that's why it is being assumed that they will take more interest in completion of elective. It is also a bit of flexibility in the ongoing learning process, which becomes a bit boring at times. So this might give a flexibility, and we can make this particular duration interesting for our students. And definitely this will help them to identify the career path by direct experiencing in diverse areas. So that may be of importance for them. Now, a lot of planning and coordination is required for the execution of electives. First of all, planning of elective will be required, then implementation will be required. So we need to be working in the planning, in the coordination with other departments and MU definitely. So while you are planning an elective, the few things should be very clear, that what are your learning objectives. Just make this clear, that what are your learning objectives, then only the implementation or the planning will be successful. Then you have to identify a preceptor. By preceptor, we mean a faculty, a person who will be taking charge of the whole elective of that particular elective in your department. Say your department is planning to have 5 electives, for example, and in each elective you are planning to have 5 students. So you will be having 5 preceptor faculty in your department. So one person will be taking charge of one elective and he will be maintaining everything regarding that particular elective in the department. A timetable of the activities should be made, like day-to-day activities or maybe weekly activities, what a student will be doing for 4 weeks, how you will be assessing that student, what will be his daily activities, what will be his learning objectives daily. That kind of very precise timetable you have to create. List of learning resources which are required, which a student has to manage, or what things you need from the institute or from the department. A list should be there. If there is any prerequisite before joining an elective, you have to make that clear. For example, if elective is from some clinical department, and you are assuming that patient care will be involved or interaction with the patient will be involved, then you can ask the student to have a good idea about the universal precautions, or maybe you can ask the student to show you the certificate of hepatitis B vaccination, etc. So they may be the prerequisites, and you should have clear assessment policy. How will you assess the students? Like formative assessment, how will you do that? Okay, you can have an exam at the end of your elective. You can ask the student to perform the skill at the end of the elective, or logbook is an essential part. They have to fill the portfolio in logbook. But an assessment policy should be clear. Only then you are going to sign the assessment of that particular student along with the attendance. Program evaluation at the end of the month or maybe end of 2 months is very important, and it will be done by all the stakeholders. By stakeholders, we mean the departmental head, the preceptors, and also the students, and you definitely. So a complete program evaluation should be done under this planning. So this is the template for electives that we have already shared with all our participants. It has got the name of the block, whether you are falling in block 1 or block 2. What elective are you planning to launch? What will be the location of that particular elective, whether it will be your own department or any lab or any other research facility. And if somebody is having any collaboration with other hospital or maybe other laboratory, that you have to identify here and write here. Name of internal preceptor, name of external preceptor. See, regarding the preceptor, one person will be taking hold of the elective in the department, and if you are having some collaboration from outside, then you have to identify an external preceptor also, and you have to do a MOU. But let's not talk about it, because for the year 2023, it has been decided that all the electives will be done in our own institute, and external preceptor concept will not come into play this time because of this COVID pandemic situation. So we will be having only internal preceptor this time. Maybe next year onwards, we can have an external preceptor or something. Learning and objectives of the elective should be very clear. That what exactly are you trying to teach your student? Like whether he will be, for example, if we take an example of diabetes, whether he'll be able to counsel the patient, or monitor the patient, or see the risk factors, etc. So learning objectives should be very clearly and simply defined, so that student can understand it, you can also understand, and all the objectives should be achievable. Don't make over enthusiastic electives which you or the department is not able to conduct at a later time. Number of students that can be accommodated in the elective should be decided by the preceptor and the department itself. Say if you have n number of faculty, and every faculty is fine with say 5 students, 5 or 10 students, then 5 students per elective can be accommodated. And this accommodation will also depend upon the number on the resources available, or say the number of patients you are having, patient flow, etc. Prerequisites of the elective, you can say any reading material, or maybe any infrastructure or any other equipment that you need for that particular elective. Learning resources, like what basic knowledge a person should have. If you are providing an elective in say diabetology, then the student should have some baseline knowledge. You can provide him some resource material, that go and read this particular chapter from this book, and then only you can come for this particular elective. List of activities in which the student will participate. It will be in alignment with your learning objectives. Then portfolio entries are required, logbook that every department has to develop, and the assessment. As I already told you, you can assess the student by any method that you want, but that assessment should be signed by the preceptor, by the HOD, and the student should pass that particular assessment to be called as completing that particular elective. And if any other comments are there. So this is the basic template that today everyone will be preparing for their particular departments or for their particular electives today. Now moving about the coordination, every preceptor and faculty will have fixed number of students. Sufficient preceptors should be there. We can have external resources, external rotation, and out of city rotations are also stated by the NMC. But for now, it is out of like our thinking because of the pandemic situation. And for 2023, please keep in mind, we are not going to have any external rotations. We are not going to allow students to go out because MOU is required for that. And right now in this current situation, because of the student safety, we are not going to allow this. So coordination, regarding coordination, we talked. Before we go ahead about the student safety, let's have another poll. When would the elective be conducted? This is just to keep all of you awake, whether you are having idea or not. When would the electives be conducted? At the end of phase 1, at the end of phase 2, at the end of phase 3 part 1, or no such criteria is there? I have got 34 responses. And okay. I'll be sharing the results first before discussing them. Are the results visible?
Yes.
Okay. So still few people are thinking that it is going to happen after phase 1. No, sir, it is not going to happen after phase 1. It will not happen after phase 2 also. It will happen only after phase 3 part 1. Currently, we are calling it as pre-final year. Okay. So, and in the new language, it is being called as phase 3 part 1. So after the student will pass community medicine, ophthalmology, ENT and FMT, after that the student will be going for electives for 8 weeks of duration, and after that only he will be allowed to go for final year, which is now called as phase 3 part 2. And this elective is compulsory, mandatory, with 75% of attendance for appearing in the final year exam. So please remember that it will happen only after phase 3 part 1, that is pre-final year. Okay, so moving ahead, student counseling and allocation. This is really a very tough part that we will be having, but we have found out easy method of doing this. How this allocation of elective will be done. Okay, say maybe every student wants to go in a particular elective. It is not possible that one department will accommodate say 100 students. That is not possible. For that, we will be making available a list of all the electives to the student by the end of the starting of the academic year. So maybe in March we will tell students that our institute is going to offer say 25 electives in block 1. This is just an example, and 30 electives in block 2. Now the students will apply for the electives. Okay, a complete written information will be given to the students, not just the name of the elective. We will be giving them the whole information, and what learning experiences will be having. We will be telling them everything, and we will also hold counseling sessions for the student, where we will tell them that what they will learn. They can go to the faculty mentors and they will be telling them what exactly are they going to learn in that particular elective. After that, the students can apply for that particular elective. Based on their merit, they will be allocated like it happens in pre-PG counseling and all. The same way, a counseling and allocation method will be applied by us. Students who are having higher marks in the previous exams will be given a chance to choose first, and then the rest of the students will come, and an allocation will be done for the electives, both in block 1 and block 2. Based on the merit, we will be allotting the electives in both block 1 and block 2 as per the availability. And this allocation will be transparent and unambiguous. Otherwise, the students might prefer a particular subject or particular topic, and so many students want to go there. So it will not happen. It will only happen on the basis of merit and availability of seats in a particular elective. So as per the timeline, in September and October, invitation of applications will happen, and in October we will be allocating the electives to the students. So this is where we are going to do this particular activity. Now students will be made aware of all the rules regarding the attendance, schedule, documentation and assessment, and allocation based on decided criteria and availability of faculty. Allocation sufficiently in advance with information, so prerequisites for the electives can be completed by the student. Student safety is also of very prime importance. In electives, safety of the student is paramount, and they should not be kept in those conditions where it is hazardous, and they should not be used as a healthcare provider. They should always be supervised. Any prerequisite, like I told you about the immunization, etc., universal precaution, good clinical practice should be told to the students beforehand, and a formal orientation will be done to the students before they go for the electives. Now the assessment, as I already told you, 75% attendance is mandatory, and they have to fulfill their elective, say, portfolio, logbooks, etc., and grades can also be given by the mentors, etc. And participation in the grand rounds, seminar, submission of assignment, preparation of abstract for the research posters, etc., can also be kept as a method of assessment, and it is like very subjective. Whatever you want to keep as a method of assessment, it's up to you. It's up to your department. It's up to your choice. Then the program evaluation. So provision of evaluation of program-based information from all the stakeholders should be made in order to evaluate the effectiveness of the program, and if any modifications are required, that can also be done. So we'll have another poll about the scope. Please answer this particular poll. Electives provide opportunity to students for all except self-directed learning, experiential learning, lateral thinking, and study at home, identify career path by direct experience for working in interest areas. Okay, so we are ready with the results. Most of the people have correctly stated that this is not a duration for them to have fun at home or study at home. This is going to be an experiential learning, self-directed learning, or lateral thinking, evoking procedure, and they will also have a hands-on experience in their area of interest. So with this, just one more thing that I would like to tell. A basic differentiation in block 1, block 2 already clear to everyone, but just this is an reinforcement that the block 1 and block 2 both will happen after the commencement of before the commencement of part 3, phase 3, part 2 MBBS. Okay, both the blocks are for 4 weeks of duration. They will be focusing on different areas. For example, block 1 on pre and paraclinical disciplines, while block 2 on the clinical specialties. And nature of learning in both the blocks is going to be supervised, experiential, immersive, and self-directed. Clinical postings will continue in block 1. Please note this point. And clinical postings will not be offered in block 2. Mandatory attendance of 75% is necessary for in both, and assessment will be done on a formative basis. Out of institutional experience, although we are not going to take this year, but out of institutional experience is allowed in block 1, but clinical postings will be continuing, so it will be at the discretion of the student and the department how will they continue it, but it is always allowed in block 2 within the city. And out of city or state experience, we need to take the approval from NMC or the other institute first, but decision regarding out of city or electives will be taken by the institute. For 2023, all the electives will be offered in our institute only. This is the QR code for the resource material that I have already shared with you. No need to do this because you have this on your WhatsApp. So this is the document which is having examples of the electives. If you open the document that I have shared already, it will show you the template for making the elective. So if you have your template with you, we will be working on that. And in this particular document that I have shared in annexure 1, 2, 3, 4, 5, 6, they have given you some examples. It is starting from page number 19. All of you, if you're having it, you can open it and have a look at it. There are some examples. First example is of medical genetics. There are other examples like diabetology and research, preceptor initiated, community clinic, emerging viral infections, and clinical infectious diseases and virology. So this will give you a fair idea how you have to prepare your elective template on this particular given template. So I guess this is all from my side. These are just examples that you are having in your hand. I have just pasted it in my slide. So these are the references for this particular presentation. And thank you. I will stop sharing here. And now we can take up the questions and a discussion can happen. Thank you, everyone.
You can type your questions in the chat box so that we can take up your questions there. In the meantime, all the faculty members from the various departments will have to, as a group work. So now this is the time for the group work or the individual work as you may be. You will have to prepare one elective right now sitting in this workshop, and you will have to, once you have made it, you can fill that template with the help of with your pen only. Then you can click the photograph and share it on the WhatsApp group. And one of us will, download it, and we can, and Dr. Medha can share your presentations on this group, and then you can present your templates, your electives. So we give you 15 minutes. Medha, would that be okay? So we give you 15 minutes to prepare your electives. At least one elective per specialty. मेडिसिन वाले एटलीस्ट एक बना ले, एक सर्जरी वाले बना ले, एक गायनी वाले बना ले, one from pedia and one elective from the other subjects, जैसे TBCD में से एक हो सकता है anesthesia, psychiatry, patho, micro, pharma. Everybody is sitting here, I can see. So everybody can make one elective from their specialty, and you can share your electives on the WhatsApp group. We can pick up 2 to 3 electives, जो भी हमें लगेगा, so we can share it with the larger group, and that can be presented in the larger group by the concerned faculty.
Meanwhile, if they have any question, ma'am, they can ask here. And,
yes, in the meanwhile, if you have any question, we can take up the questions. But elective अभी सबको एक-एक तो बनाना है.
Pankaj sir wants to ask a question, ma'am.
हाँ जी. Sir, you can unmute yourself.
Sir, can you unmute yourself, sir?
Am I audible now?
Yes, sir, you're audible, sir.
Okay. Actually, I'm sorry because I was putting it on the chat, but then chat is not picking up my message, so I have to speak it out.
It's okay, sir.
So the point is that, you know, I am a little bit confused. It seems that there's two directions of thinking happening here. One is that you are saying at the outset that the student has to pick up his own choice, and then he has to decide about what interest he has got, and then to work on that subject. At the same time, in the second breath, you are talking about the teacher to be, you know, taking all the onus of it, taking all the responsibility, picking up all the subjects, and then pushing that boy to or girl to that particular subject. Now, this is I've decided, now you have to go for it. So what is it? There should be one way of it.
Actually, what happens, like it depends in surgery if you have made 10 electives. So there would be like, and you have an opening only for maybe 50 students, you know, 5 students per elective. अब 50 बच्चों के लिए जो आपने खोला है यहाँ पे elective, suppose the number of applicants for that particular elective is 70. So who are those 50 people who will get into your specialty? So that will depend on the merit.
No, but
There's nothing.
No, but then first of all, let them, let it be, the part one should be open to them, that let them come with their own choices.
We will be giving all the choices to them.
Yeah.
And the merit can be made in 2 ways. One is based on their previous university exam, or the merit on the basis of number of students applying in an elective. Like जैसे आपके ही subject की merit मतलब बन रही है, आपके elective में जैसे 50 में apply किया है, उन्हीं की merit बनेगी.
Okay.
It will be like that.
Okay. Okay.
Ma'am,
Any other
ma'am, we have got another query. Our department cannot make an elective for block 1 as a research, asked by Dr. Pritosh sir from ENT. Our department cannot make an elective for block 1 as a research.
नहीं, actually Dr. Pritosh, आपका department जो है, that comes in block 2. You can definitely have a research elective, but because your department comes in block 2, it will be considered as, you know, because your research project will also be from ENT only. So it will be considered as block 2 elective only. Block 1 is reserved for pre and paraclinicals departments. All the clinical and super specialty departments, they are the part of block 2.
But madam, I can make the research elective for block 2 also.
Definitely.
Okay.
Definitely. आप अपने यहाँ पे जितने आपके mentor हैं, उतने आप elective बना सकते हैं.
But
No.
Dr. Pritosh sir, I want to tell one thing.
Yes.
If you are going to have a elective like research, तो आपके subject का उसमें कुछ चीज आ नहीं रही है. So if any student who want to come to your department in ENT department, so he or she want to learn something related to ENT. So you have to make your elective related to ENT department, not the research. Research can be taken by pre or para.
No. Say we have our PGs with us, and they have their ongoing projects.
Yeah.
So we can accommodate them in this research.
You did not require to just understand about what is the research project title. There's no need of this title in this elective. Title की जरूरत नहीं हमको कि आप एक टाइटल बना दिया रिसर्च प्रोजेक्ट का, उसके बेस पे बच्चा काम कर रहा है. ये नहीं, आपको तो वहां पे अगर सिखाना है तो रिसर्च मेथोडोलॉजी के बारे में सिखाना है कि हाउ टू कंडक्ट रिसर्च. तो दैट कैन बी डन बाय प्री एंड पैरा क्लिनिकल फैकल्टीज. So that is not basically up to your people. What I can say to you.
Sir, जैसे आपने प्योर टोन ऑडियोमेट्री पे इलेक्टिव बना दिया है ना, आपके यहाँ पे बेरा का इलेक्टिव है या प्योर टोन ऑडियोमेट्री का इलेक्टिव है, so that type of elective can be taken up by the students.
Dr. Gaurav sir, you want to say something, please? Please unmute yourself, sir.
जी.
Yeah, I totally got that. As you said, we can create electives on whatever is available in our department.
Yeah.
and in that specific area we can teach them to develop their skills in that specific area, and we can assess according to that what objective we have created already, and whether they are fulfilling those objectives or not. According to that, we can assess them and we can give them marks. You are saying so?
Yes, I guess so.
Yes, sir.
Exactly.
Yes, sir.
Exactly.
You are 100% right, sir.
Okay.
Like in future, that student is going to, sir, in future, that student is going to come in respiratory medicine department. So that elective should be related to respiratory medicine, कि उसको attract करना है किसी तरह, उसका है ना electives में ऐसा interest वो है ना, in future में जाके PG में respiratory medicine को ही select करे. Am I right, Dr. Medha?
True, sir. True.
Yeah, we are doing that only. We are teaching them bronchoscopy. We are teaching them ICD, how to do the ICD and how to do the bronchoscopy. But according to their limitation, we are teaching them.
Yeah.
Yes, आपको interest create करना है उस elective के base पे बच्चे में.
Right. Right now we are doing with interns, but now what I understand is they are going into their final MBBS, and before choosing their career, they will be very much clear where they should go. That I got.
Yes.
Pediatrics से भी question आया है एक. Nalini, what is the question?
How many learning hours?
And they're asking
Yes.
that how many learning hours every day a student should be having in the department during the time period of electives.
So block 1 में they will be going for their clinical postings, but block 2 में they are there with you from 8 to 2:30.
So pediatrics.
उतनी देरी वो है आपके साथ.
During electives, there will be no teaching at all.
No.
There will be only clinical posting in block
No
1.
theory classes.
No theory classes will be there.
कोई theory class कहीं भी नहीं होगी, तो सारे टाइम बच्चे आपके पास ही रहने वाले हैं, except in block 1 जिसमें clinical posting होगी mandatory.
बस वो 3 घंटे के लिए जाएंगे block 1 में. block 2 में पूरा टाइम clinics में है. So basically the concept is कि जब वो प्री और पैरा में है तब भी उनका हॉस्पिटल छूटना नहीं चाहिए, और जब वो हॉस्पिटल में है तब तो वो है ही है ना हॉस्पिटल में. So basically we don't have to wean them off from the or keep them away from the hospital.
Dr. Sanjay Gandhi sir is saying that for his branch duration should be more, at least 9 AM to 5 PM.
So वो आपकी prerequisite में आ जाएगा सर. That you will
आप
put in
बोल
your
सकते हैं बच्चे को.
prerequisite. जब तक आप हैं तब तक बच्चा साथ ही रहेगा आपके.
9 to 5 आप रखना चाहें, पूरे 24 आवर भी रख सकते हैं सर. इलेक्टिव उसको सीखना है. इन फ्यूचर ही इज गोइंग टू बिकम ए कार्डियोथोरेसिक सर्जन, तो उसको आपके पास रहना ही पड़ेगा.
And above that, sir, it is a student-centered and student-initiated thing. So they will, if they agree to 9 to 5 or 24/7 work, then only they will pick up your subject or your elective. So this is like they are choosing you. So no ifs, no buts. They will have to come.
They have to shadow you on this. Another thing, the future perspective is once our electives are ready, our institute is also on the global portal for student exchange. So अगर हमारे electives अच्छे बन गए हैं and we are done with our student ones, so we can even post our electives on our GMCH portal, and we can start accepting these students from the other colleges and other countries from our partner colleges.
Ma'am, if there are no more questions, then we have received electives from pediatrics, medicine, and ophthalmology. So should I share screen and share their electives so that we can discuss at least 2-3 here?
पहले pediatrics का एक share कर लो.
Yes, ma'am, sure.
फिर medicine का share कर लेते हैं, then ophthalmology.
Sure, ma'am.
Another one from forensic medicine has also arrived.
Okay.
Wow, commendable.
Is it visible?
Yes.
Okay. Only half of the screen is visible somehow, ma'am. Or is it like okay?
Yes.
Ma'am, you have to enable the editing.
Okay. Got it now. Now is it visible, I guess?
Yes, you can enlarge it, Megha. You can zoom it up a little. नीचे से ना आप
Sure, ma'am,
उसको
sure.
zoom कर लो.
Yeah.
Yes.
So
No,
this
that's
is,
right.
yeah, ma'am.
We will invite the brainstorming from the other departments also.
Sir, actually, sir.
So this is block 2, name of elective neonatology. Location is in NICU and labor room, and the internal preceptor is Dr. Sushil. Yes. No external. Perfect. Learning objectives. Sir, will you please present your elective?
Okay, ma'am. So we have made this elective for Department of Pediatrics. So this elective will be, just a minute, ma'am. So this will be the block 2, and name of the elective will be the neonatology. So location in which the student will come will be the NICU, neonatal intensive care unit, and labor room of the Gitanjali Medical College Hospital. And internal preceptor will be Dr. Sushil. This will be he is the in charge of neonatal unit. So no external preceptor will be assigned. Then learning objective includes, first objective will be describe the physiological adaptation of the newborn to extrauterine life and the steps in neonatal resuscitation. Then another one will be demonstrate proper and effective delivery room resuscitation technique for newborns. Another one includes perform an appropriate assessment that will include history, physical examination, and initial diagnostic studies, and formulate a differential diagnosis for the following common sign and symptom. We have included only prematurity and growth failure for these students. Then describe the physiological basis of the key principle of management for the following common condition that includes respiratory distress syndrome, transient tachypnea of newborn, hyperbilirubinemia, and neonatal sepsis. Then explain the indication for ordering and interpret the result of the following laboratory and radiological tests that include CBC, differential counts, hematocrit, blood type, bilirubin, urine analysis, bacterial or viral culture for blood, CSF or urine. Then another one include communicate and work effectively with member of NICU patient care team and with parents and families of critical ill neonates. So we have assigned 8 students can accommodate in this elective. So prerequisite will be the basic knowledge in neonatal resuscitation will be required for this. Then learning resources include OPH textbook of pediatrics. Then activities, the student will participate in the neonatal resuscitation activities, then history taking and assessment of the neonates, then counseling session along with the faculty.
Sir, neonatal resuscitation jo hai, the student will be doing it on the neonate or he will be doing it on a simulated environment?
मैनिक्यूर में करेंगे बट मैम जब जैसे लेबर रूम रिसर्चेशन होगा तो दे विल ऑब्जर्व
they will observe. बिल्कुल sir, they will observe and करना जो skill करना है that will be done on the mannequin.
Yeah. Portfolio entries includes record history taking, record counseling session, and activities performed and counseling sessions. Right? Then logbook entry is required. Yes, satisfactory completion of posting signed by the preceptor. Then assessment will be assessment, attendance. Then successful verification of required portfolio entries and successful completion of the posting is certified in the logbook reports.
Any comments from the other groups? Other department?
Can I?
Yes.
Hello. I'm just thinking from my department, if we are doing this elective for bronchoscopy learning, if I prepare that, then that time we can only give them chance to observe, not to do not to perform the bronchoscopy, because we have limitations.
Independently उनको perform करने के लिए नहीं दे सकते. They can do it on the mannequins in the skill labs.
but we don't have many kids, so we only give the chance to observe only. Is it okay?
Yes.
Yes, sir.
Okay.
Sir, it is okay. They are going to observe you for a period of around 1 month. So after at the end of 1 month, they can learn so many things, and you can assess on the basis of this observation only.
Sir, counseling, history taking,
yes.
वो सब चीजें भी तो बीच में आ रही है ना?
Perfect.
And sir, observation itself is a very strong learning tool. Students learn a lot of things by observation only.
But this elective is very well made. बहुत अच्छा बना है. Very well done, team pediatrics. Medha, you can share the elective from general medicine now.
Sure, ma'am. Just give me a minute.
Any elective from the surgical branch we have? Ophthalmology we have, right?
Yeah, ma'am. Ophthalmology and psychiatry people have also shared.
We'll appreciate one from general surgery also. So that is going to give us an insight into
Can I, Dr. Sanjeev, Dr. Sanjeev, you can post your elective. Already we have prepared surgery. Dr. Sanjeev Agarwal.
You can post it on WhatsApp. You can post it on WhatsApp. We'll pick it up from there and share it here.
Ma'am, here is the one made by the medicine people.
Ma'am, there is another one which is a typed one.
Yeah,
also.
actually, I am trying to find it out. Just give me 1 more minute. I'll find it out.
Yeah, ma'am, it's on the WhatsApp.
Yeah.
Those who can do it on the typed, we have already shared the document template, so that can be used for typing the elective.
Is it visible now?
Yeah.
Okay.
Zoom it.
Yes, you can zoom it up.
Is it okay, ma'am, now?
Perfect.
Okay. So someone from medicine can present it.
थोड़ा और बड़ा कर लो मेधा इसको.
जी मैम.
Unmute हो गया unmute कर दिया.
Am I audible? I am now Dr. Navdeep Mathur. Am I audible?
Yes, you are
audible.
So I am from General Medicine Department. So our block is second, and name of the elective is diabetology, and location of the location is General Medicine Ward at GMCH. Name of the internal is the Faculty of Medicine. And we are not including any external faculty. And learning objective we have already divided into 3 domains to cover all 3 domains. It is related to the diabetes. In knowledge part, we have include at the end of the elective posting, the student is able to diagnose diabetes in a patient and able to identify risk factors of diabetes in given patient. Patient is able to identify complication of diabetes in given patient. Patient is able to plan treatment of diabetes mellitus in given patient. And in skills, we want to that students should able to perform urinary ketone analysis by keto sticks to measure blood sugar by glucometer and to give and able to give subcutaneous insulin under observation. And in attitude and communication part, we want patient student should be able to counsel diabetes mellitus patients about lifestyle and dietary modification, and to counsel diabetes mellitus patients about symptoms of hypoglycemia and home-based management of hypoglycemia and timing of OH and insulin according to their treatment plan. Prerequisite is basic knowledge of diabetes, and students should have to pass third MBBS part 1 already. Learning resources is chapter of diabetes mellitus of endocrine section of Harrison Principle of Internal Medicine. List of activities, participation at the ward rounds, and take part in discussion in respect of diagnosis, risk factors and complications, and treatment plan of admitted patients. Preparation of risk factors and complications list of every admitted diabetes mellitus patient. Blood sugar monitoring of diabetes mellitus patients by glucometer, urinary ketone monitoring of DKA patients by ketone stick, gives subcutaneous insulin under observation, counseling diabetes mellitus patients about lifestyle and dietary modification, and counsel diabetes mellitus patients about symptoms of hypoglycemia, home-based management of hypoglycemia, timing of OHA and insulin. Portfolio entry required is daily log of patients seen and activities participated, fill checklist of risk factors and complication of admitted diabetes patient, and fill blood sugar and ketone charts. Logbook entry required is satisfactory completion of posting by preceptor with meet expectation. Assessment is done by attendance of 75% at least, successful verification of required portfolio entries, and satisfactory completion of posting by a preceptor with meet expectation, like the student is able to check blood sugar by glucometer, urinary ketone by glucose stick, can give subcutaneous insulin under observation, and can counsel patients satisfactorily. That's all, ma'am.
That is very well presented. जो आपने इसमें resources लिखे हैं ना सर, वो पूरी की पूरी किताब मेरे हिसाब से, क्योंकि यहाँ पे दिख नहीं रहा है, I think आपने सिर्फ हैरिसन उसमें
That is,
quote
ma'am,
करा है.
only one chapter of diabetes mellitus, only one chapter. This
हाँ, that will
chapter
be
of
okay.
diabetes mellitus of endocrine section of Harrison Principle and Internal Medicine book.
I have one submission. We can also keep, when we are doing assessment, so when if there are certain things like counseling है, या हमारे पास में वो keto dipstick है, या glucometer वाली जो findings है ना, that the student will be doing the estimation of blood glucose level by the glucometer.
Yes, we will.
Because that can that be given? I don't think there is a problem in giving this to the student.
Basically, we are already doing this with patient is having these all these things with them.
And for assessment, I think we can also use multi-source feedback when the student is there with us for 4 weeks. We can even put up other methods of workplace-based assessment.
Like, ma'am?
Like multi-source feedback. Take the feedback from the patients, from your residents, from the ward staff, that whether how was his conduct. So that can also be a part of the multi-source feedback.
So, ma'am,
Or
this
you
is
can
initial
conduct
stage. More about this, ma'am. This is just a initial input.
No, I am suggesting.
Okay, ma'am.
I mean, I am also, you can say, on the same page as you guys are. We are also learning it. So it is just a point which came to my mind, that for assessment, we might also think about the multi-source feedback or the other toolkits, other assessment methods from our toolkit.
So, ma'am, it is assessment.
Maybe OSCE for certain things.
Yes, ma'am. So
maybe OSCE for certain things. जैसे उन्होंने neonatal resuscitation में mannequin पे रखा था. Maybe an OSCE that whether the student is able to do a neonatal resuscitation in a simulated environment or not, on a mannequin or not. Is he following all the steps or not? So that can be, assessed on the OSCE in the simulated, we can say, scenario. Probably.
Dr. Nubgit.
Yes, sir.
Yes.
Your affective part domain objectives are very nice, but what do you think about that the student is going to plan treatment for diabetes mellitus in third part 1 before conducting this whole second year part 2 part to plan treatment for diabetes mellitus? It's a very, I think, He can just understand, he can just know the treatment, ki what are the different type of drugs.
They have
medicine.
already passed to the pharmacology section, and this is a learning process thing, and initially we have said that they will take part in the discussion of the participate at the ward rounds and discussion about the diagnosis, risk factors, and complication and treatment of the admitted patient.
So again,
or we can say that they would be participating in the discussion on the, participate in the planning, or they can,
they can participate in the planning. Yeah, that can happen, but they cannot plan the treatment. Or if they are going to plan the treatment, then it should come in psychomotor domain. They are going to plan. They are going to do something that is not under cognitive domain or knowledge domain.
Treatment will be planned by us, and only discussion will be there.
It is in the knowledge domain or the cognitive domain. It is already in the. It is not in the skill domain.
Sir, he is going to plan something. तो उसको सोचना है, करना है.
Sir, they should know
prescription
writing the knowledge. Sir. Students should have the knowledge.
Have the knowledge about the drug available for the treatment of diabetes mellitus. But then he is going to select that drug, and then he is going to prescribe that drug that comes under psychomotor domain. So,
okay, sir. Okay, sir. Got it, sir. Okay, sir. Got it, sir.
Okay, sir.
So, ma'am, now
we can take from surgical.
Yeah. Should I share from surgery, general surgery, ma'am?
Yes.
Just a moment.
Because सबसे ज्यादा जो बच्चे समाने वाले हैं वो मेडिसिन और सर्जरी में ही they'll get absorbed, because बड़े सबसे ज्यादा electives यही बनेंगे.
Okay. So is the screen visible?
Yes, it is. You have to zoom it.
Yes.
We show the first page.
Okay, fine. Fine. So just give me a minute.
Who is presenting? संजीव सर आप कर रहे हैं कि सुमन मैम कर रही हैं?
Me, Sanjeev.
जी sir.
Is it visible now, sir?
Yeah.
Yes, it is.
So here is the template for the planning of elective. The name of block is 2, and the elective is chest injury. And location of hospital lab research facility is emergency department, International Medical College. And name of internal preceptor is Dr. Meet Patel. He is assistant professor. Then learning objectives are to assess the chest injury patients in a supervised environment in an emergency department. Second is to function as a team member in a polytrauma team, and counsel patients about chest injury, and learn how to place intercostal chest brain under supervision, and describe the pathophysiology of hemopneumothorax, apply to chest trauma patients. The number of students that can be accommodated in this elective is 4 to 6.
Sir, you will have to keep a discrete number, either 4 or
6. Yes. Just give me one moment. I will show the next page, sir. Yes.
The prerequisite for the elective is must receive necessary immunization and must know basic life support training. Learning resources is textbook like Billy and Love, short practice of surgery. List of activities in which the student will participate. Number 1, attend chest trauma patients in emergency department. Then participate in IV cannulation, ventricular intubation, catheterization, health session, and health monitoring. Then again participate in the management of chest trauma patient, like insertion of intercostal chest to drain, and then participate in patient education and counseling. Then take post-operative rounds and learn post-operative care. Portfolio entries required. We can give some assignments, self-assessment. We can take feedback from the student, and logbook entry required is satisfactory completion of posting by a preceptor with a meets expectation like M grade, and assessment in the form of attendance, formative assessment, or short viva we can take. Then documentation of attendance, required portfolio and logbook entries.
Any input from the other groups? Other departments, if you have any inputs, any comments on the presentation? So we have this. मुझे इस सारे में आपका जो activities and assessment जो है, that has, I really like the way you have.
Rather than elective.
Yes.
It looks like more of competency rather than elective.
We're just testing.
So what changes do you suggest from your side?
Emergency, you know, like
emergency
polytrauma,
trauma center posting or emergency posting.
Polytrauma में फिर it will not be only from surgery, it will be multidisciplinary. अभी अपना क्या department of emergency medicine बना नहीं है. Once the department of emergency medicine is there, so all these things will come in the polytrauma and it will be taken care there. All these things will be a part of emergency medicine. He has rightly pointed out.
The timing here, again, we have to take care because the patient might come on odd hours. So the student should be like made aware that they'll have to visit the hospital in those hours also. Those who can do that, only those students will take up this elective.
That is true.
So we have various other electives. We have received electives from psychiatry, orthopedics, neurology, and what else, Dr. Nalini?
We have also submitted from anesthesia department also.
Yes, ma'am. I'll just tell you. Ma'am, should I just
tell the name of the elective?
Yeah. So we have got an elective on modified electroconvulsive therapy by psychiatry department, palliative care by anesthesia department, sports injury of the knee by orthopedics, molecular biology by microbiology, medical oncology by Dr. Renu Kameshra ma'am and Dr. Anish sir. That is oncology department. Forensic medicine has sent an elective named injury report.
Dr. Renu Mishra se aaya hoga, oncology wala.
Ma'am, by the name of Dr. Renu Mishra, another elective is there which is named as neuroelectrophysiology.
फिर वो उल्टा हो गया because electrophysiology should come from Dr. Renu Kameshra ma'am.
Exactly,
Yes,
ma'am. That's why I've noted the name.
Yes.
And community medicine has given an elective on immunization program in a rural setup. Pharmacology department has given clinical pharmacology prescription audit. There are two electives, ENT department has named their elective as ENT and pathology department has named their elective as pathology?
They'll have to pick up something, pathology department can give an elective on the hematology lab, in one of the sections of their laboratory work. They can pick up anything like that.
Yeah, we can give clinical pathology, histopathology, cytology, different sections.
Even blood bank, sir. Blood bank is a very beautiful
yeah.
elective.
Blood bank can also be done, yeah.
Blood bank is a very, very pertinent elective for a undergraduate student.
Yeah.
So I think we have understood the concept of electives and we are ready to jitne hamare paas AP and above faculty hai, we can create as many number of electives and we can, submit to the Dean office by 28th of February. So आपने देखा 15 मिनट में एक elective तो बना लिया है. It is not a very big thing to do. So by 28th of February on or before 28th of Feb, let us compile all our electives and then we can, the MEU will sensitize the students also. And then the students, they will be exposed to all the available electives. Then if any student has any questions regarding a particular elective, he or she will contact that preceptor that what am I supposed to learn? How will it help me? So there would be certain involvement of the preceptors in this. And then finally, we will begin the selective programs in the coming slot after their third part one. If you still have any questions, we'll take up your questions. And if not, then we will end this meeting with and for which I will hand over the further proceedings to Dr. Medha.
Ma'am, we are having a question from Dr. Pitosh, sir. So you can unmute yourself and ask, please.
Ma'am, how many numbers of electives should go from our department, as the resources in our department are very limited, as the number of professors, AP and associates are there.
So that will act as a resource. Yeah, yes, ma'am, please.
Sir, हाँ, 3 आपके हैं तो 3 electives ही बनेंगे आपके.
Only 3. Okay.
Yes. Ma'am, are we going to give a minimum number of elective for each department? That there should be some minimum number.
अभी एक बार नहीं, let's see एक बार सबको बनाने देते हैं कि जितने आपके पास में faculty हैं, AP and above. Look, let's see the people who are actually, here in the workforce with us. We are also having it from the broad specialties, super specialties. We are having a good pool.
Yeah, but minimum of 125 students should be accommodated. Less than that will not be acceptable. Then
so we can have, around 10 students agar apan kar sake per elective, so that will take care. Maximum upper limit 10 student kar sakte hain.
Yeah.
Rather
Upper
than
limit should not go beyond 10. That what we understand. And lower limit should also not go beyond 4, because one faculty can definitely handle 4 students.
Let it be 5.
Okay, 5. Take it. 5, and every department should at least send 2 or 3 electives based on the number of faculty they are having. That should be the minimum number.
Pardon, ma'am? Ma'am, internal preceptor, when we are talking about, so as I've seen in the electives submitted on the WhatsApp group, in some electives there are 2 internal preceptors also.
So why to waste resource faculty of 2 preceptors? Actually, you know what, if you have 2 preceptors, it will be nobody's baby. So keeping 1 preceptor means it is owned by a person. He is responsible for that particular elective. So 2 preceptors can have 2 electives. So it's actually, it's written there that you can have 1 preceptor per elective.
Another thing is like in absentia of a particular person, this comes to our mind that what will happen to that particular elective, or say person goes on leave for 7 days or something. For that particular thing, the elective should come as a departmental thing, so that any other person can take care of the things for those 7 days, or that particular work can be handled by someone else. So it should be a departmental activity, but a person who is going to be the in charge of that particular elective should be one person, as ma'am said. So as we are not having any other queries, so we assume that everyone is clear. And yes,
Dr.
ma'am.
Shaishta was there, no? Dr. Manjinder, she wanted to tell something.
She has gone for the viva. मतलब उन्होंने viva शुरू कर दिया. She's an examiner here actually.
Yeah, both things she can do. Okay, anyway, Dr. Medha, it was very nice presentation. Everybody must have understood and cleared everything. So thank you. Congratulations.
I also thank everyone for taking out the time from the busy schedule and this COVID crisis. We are still meeting online. And another meeting we will be doing on 28th, where we'll be studying about, we'll be getting familiarized with the learner doctor method of teaching, which is yet another component of new curriculum. So that will be taken by Dr. Harpreet Singh, Dr. Navgeet Mathur, Dr. Nalini, Dr. Suman Parihar, and Dr. Manu Sharma. So this team is going to talk about the learner doctor method of clinical posting. On 28th, same timing, 12 to 2, on the same platform, Zoom.
So I thank everyone for joining us, and we are looking forward for rest of the electives. And please make it in a formal way, in a Word document, get it printed and get it submitted to Dean Office by 28th of February. And I'm thankful to MU for giving this opportunity, and thank you Manjinder ma'am and rest of the MU team.